Benjamin Akako is my name, and I welcome you to this installment of my Unfiltered Thoughts. I call it Benjamin Unfiltered, where like a master brewer, I shall distill the unfiltered truth for you. And it's going to be on subjects that impact all of us. And today, I'm going to be speaking on a subject that impacts all of us. A health sector in the ICU. Systemic problems of yesterday that still plague us today. A health sector in the ICU. Systemic problems of yesterday that still plague us today. We often say health is wealth. And it's true. But how are we guarding our health in the country? I always say the efforts will be made on the individual level, not to fall sick, through being careful, through what you eat and what you drink and all of that. But there are times where, naturally, you may fall a bit ill. When that happens, are you going to get the best of care? On the national level, efforts are made by every administration to bolster the health setup. But there still remain gaps. Individual gaps, collective gaps. How can we collectively solve the problem? Come with me as we take a look at some of the challenges we've seen in recent times, in recent months and weeks, and where we are and what possibly we ought to be doing. Now, per reports that we have seen in recent times, there was that victim of a hit and run incident who was refused emergency care. And the reason for refusal, at least it's not just one person. No vacant beds available. And I heard an interesting discussion in recent times where someone was talking about the fact that, listen, why can't they just put more beds in these facilities? And then it struck me, sometimes our thinking is, so just add more beds. It's not that simple. For example, if a facility, let's say the bank hospital, and I'm not using them as an example for any negative intent. I've not even checked how many beds they have. Though before the opening of that hospital in cantonments, I played quite an interesting role. Let me leave it at that in terms of a story I put out and when it was not open and how eventually it got opened. But if, let's say, some hospital has a 120 bed capacity, it means the capacity of that facility, that institution, is 120 beds. If any others are added, it would mean that more space has to be created because the beds have to be in space, right? So sometimes it's not just about, add more beds. It's about, where are we putting the beds? There are different factors, not just the cost factors, but that also to take a look at. Now, on that hit and run issue, the crucial point to be made is that for over 1 hour, there was movement between different hospitals to find not just a bed, but some mitigation, some emergency care for this person. And that did not happen. The victim of the hit and run incident, now the hospitals that refused him, the police hospital, the Bridge Hospital, Accra Regional Hospital, Kolibu, all three major hospitals in our country. If you look at the timelines ahead of the patient's death, 10:40 p.m., the patient was placed in an ambulance at the Kwame Nkrumah Circle area. By 10:43, 3 minutes afterwards, the person arrived at the police hospital and admission was declined. The timing here should actually be more. There's a little that possibly has to be tweaked there. At 10:58, the person arrived at the Ridge Hospital and admission was declined there as well. Then Kolibu, the teaching hospital, admission was declined there as well. This was as late as 11:20 p.m. 10:40 p.m., placed in an ambulance at the Kwame Nkrumah Circle. And yes, the arrival at the police hospital was swift, but I think it's slightly after this time. By 11:20 at the Kolibu Hospital. So denied, declined. And when I say declined, not that they intentionally said it, it's just that they simply couldn't deal with the situation. At around 12 a.m., the patient was pronounced dead. From 10:40 to 12, that's a little over an hour, about an hour and 20 minutes. And at 12:50 a.m., the body was conveyed to the mortuary. You know what's interesting about all of this? It could have happened to any one of us. And in fact, during the COVID era, I've spoken about this in times past, where I moved from hospital to hospital when I was having some breathing issues. One dawn, I called, people were not picking up. I had to find a way of getting myself up and, trying to seek refuge in a hospital because I had contracted COVID at the time. And it could have happened to any one of us. That's how serious the situation is. Now, HEFRA, the Health Facilities Regulatory Authority, launched an investigation into the alleged refusal of the emergency care. There have been some, investigative comments passed on this. A full-scale investigation was launched. The investigations, they said, would be thorough and transparent, and the report would be submitted to the health minister. More has to be done in terms of following up on those. Now, in terms of Korle Bu, they interdicted staff over the alleged refusal of emergency care, while there were concerns about why the person was not attended to. I have also read about the situation they had to deal with. But an interdiction followed. 2 medical doctors were interdicted, 2 nurses were also interdicted, and an investigative committee was constituted. One thing we're very good at in this country is constituting committees to delve into some of these matters. The problem sometimes is when they come out with their reports, implementation. But if you look at previous cases of the no-bed syndrome, and like I said, this thing has been with us for so long, at a point we have to sit down as a country and just ask ourselves, how do we solve this? How do we deal with this? People will talk about the erstwhile administration and Agenda 111. People will talk about the current administration and all the funds being pumped into the health sector. But realistically, how do we deal with the situation? When I get to the following slides and you look at the doctor to patient ratio, it will create a picture in your mind. We have to meet UN standards and we have to do better when it comes to our healthcare situation. It's not to say nothing is being done, but can we do better? I have many medical doctor friends, I have many nurse friends, and sometimes looking at the scenarios we faced in the past and what we are facing currently, what can be done? It's a conversation we're having. A man, 70, died after 7 hospitals rejected him. 7 hospitals, and at 70, he was gone over a lack of beds. If you look at the date, you will see June 11, 2018 there. The Suntreso Hospital, woman 30 and unborn child died over a lack of beds. And of course, this also reminds me of that recent incident, the midwife and the 27-year-old, may her soul rest in peace, who passed. And this was July 11, 2018. Actually, if you look at these dates, June 11, 7 hospitals turned him down, 2018. July 11, exactly 1 month later, 2018, another incident, a woman, 30 years, and her unborn child dying over a lack of beds. Just a 1-month interval. And this is occurring. Now, the leading causes of Ghana's no-bed syndrome: inadequate infrastructure, lack of healthcare equipment, limited teaching hospitals, a lack of referral communication, and insufficient healthcare workforce. That's according to joint studies by the University of Toronto and the Ashesi University. And we know the problems. So if we know the problems, where do we get the solutions from? Why are we not addressing the problems? Because like I'm saying, these things we are talking about, they could happen to any one of us. If it happened to you, if it happened to me, would we survive it? Now, the Ghana Medical Association on the no-bed syndrome, if you've followed the discussions, Dr. Richard Selome, the General Secretary of the GMA, he says there's a challenge of dumping. No matter how many beds we provide in Korle Bu, if all the peripheries are dumping into Korle Bu and are not strengthened, Korle Bu will always have no beds. Ridge will always have no bed. Komfuanochi will always have no bed. The point he's making here, and it's also a very valid point, because when you look at the situation, I pity our healthcare workers sometimes. Sometimes you can go to a health facility and you can see them wearing exhaustion like a robe. They're tired. And they have to deal with so many situations. I'm not holding brief for them. There are times where you can talk about real medical negligence, but you must look at the human side of it, the human factor. They're also human. Now, this situation here is a major problem. Sometimes you go to other clinics, other hospitals, they may not be teaching hospitals, they may not be at a certain level, but there are certain things they should be able to deal with. They don't deal with them, they just refer. It's like a fan belt. Oh, pass them over. Pass them over. So 37 gets full. Police hospital gets full. Kolebu gets full. The main ones get full. And then once those places are choked, when serious emergency cases come, where are the facilities to deal with those situations? And sometimes this is why people die, because in the chain, it's like saying you've moved from the nursery straight to the university. You must go through the process. But the patient maybe should be at the nursery, or should be, let's say, in basic school, and we move them straight to the university. That's what's happening here. That's the situation. And it's problematic. And don't you forget, sometimes we forget that places like Kolebu, people come from the entirety of the sub-region, from other countries, neighboring countries, because they also lack health facilities. They come to Kolebu and Komfuanochi and other places, but especially Kolebu. So if we do this and turn around and be the same people complaining about no beds, it means we are part of the problem. There is no centralized point where we can know how many beds are available and where in real time, which is another problem. We should be able to have a digital system where we can say, okay, so we have to transfer this patient. There's a valid reason for the transfer, maybe to the University of Ghana Medical Center, or maybe from the UGMC to Kolebu. But how do we check that at Kolebu there's a bed available in this unit at this ward, so that we can send the person there, rather than just send the person there and the person gets there and there's no bed? That's what he's pointing to. Another serious issue, a layer of the problem we have to consider. Now, in terms of retooling Ghana's public hospitals, the last major retooling exercise was conducted in 2014. How many years ago is that? 12. 12 years. That was the last time we engaged in any retooling exercise for Ghana's public hospitals. And you see, so sometimes when we complain, the issues are there, they are there. And truly, your health are concerned. Our health is their concern. Sometimes they have their problems, but all the problems are not at their, table. There are problems coming from us too sometimes, and then from other areas. Now, the total registered medical and dental practitioners in Ghana, I told you I'll get into the figures, right? We have registered practitioners, 13,177. That's according to the Medical and Dental Council. Now, if you look at the total registered medical and dental practitioners in Ghana in terms of registered practitioners, this is the number. But what is Ghana's population according to the 2021 census? 30.8 million. Some more current data puts this figure at quite a bit higher. But if you do the mathematics in terms of the number of practitioners versus our population, you would have a doctor to patient ratio in terms of population of 1 doctor to 2,337 people. Now, just stop for a moment. Pause. Think about one medical doctor dealing with this number of people on a daily basis. It's not necessarily the case that they deal with this number, but in a catchment area, likely this is what happens. And in some communities, the same way you have areas where lawyers, you may have about 2 or 3 or 4 in a certain space or even a region. You may also have certain areas where 1 doctor or 2 are in a community, deprived. Sometimes places that, for some reason, medical practitioners find it difficult to stay, do not want to go to. I don't want to get into that argument because It's like a chicken and egg situation. And there are reasons for and against. I don't want to get into that today. But this is the reality we are looking at. How realistically, even a robot would have, problems at a point. Now, the workforce statistics, if you look at it, 70,000 unemployed health professionals, and 69% of them are nurses. The backlogs we've created over time, over a long period of time. This is what it amounts to. It can help solve the problem, but then we also have quality control issues. Some people sometimes talk about people who have stayed home for so long that they've actually forgot what they learned because there's no practice. How do we deal with it? I don't have all the answers, but this is per the Health Ministry and the NDPC's 2024 report. Then the nursing training allowances between 2020 and 2025, how much was allocated? 2.47 billion Ghana cedis. Out of these, now if you contemplate the health budget allocations 2020 to 2025, you're looking at 74.8 billion, out of which wages and salaries alone swallow 46.8 billion, 63%. The remainder, you are looking at capex, capital expenditures, and goods and services, 28 billion per the finance ministry. This is how much we're expending. And if you take a breakdown of Ghana's 2026 health budget, we're coming into the current space. 22.8 billion Ghana cedis was committed. Wages and salaries expected, 16.2 billion, that's 71%. Goods and services, 4.5 billion, that's 19%. And then capital expenditure, 2.1 billion, that's 9%. But let's take a few comments. My own good friend, Dr. Kwame Sapo, he is a CDD fellow. And he says it's not just about where the beds are, it's about the resources and the right medical expertise at each facility. Remember what I was talking about? It's not just about the resources, it's about the right medical expertise it's not just about where the beds are, it's about the resources and the right medical expertise at each facility. It shouldn't be the responsibility of patients or their families to track bed availability. We've talked about this for years. Why is it still not in place? Because honestly, I shouldn't be going to X medical facility and now trying to make calls to maybe Kolebu or Ridge or something through my connections to find out whether there's a bed available, because maybe I have a relative and I may have or know certain people or have certain connections, so I have to call and then find out. I shouldn't be able to do that. There should be a system where, a central point where we can check all of this. And then for certain, because the calls have been made and they are expecting you. So you don't go and then you are told there is no bed. It's not been done in the past. Can we do it today to make our health system more secure? And where I'm going to end, the lifespan of an ambulance, because also we in having this conversation, we factor in the ambulances and the role they play, crucial role they play. The lifespan of an ambulance is 5 years. And the 5 years are not for the Ghanaian road conditions. I just, on the back of this, I just want to say, I don't know how many of you have noticed, but our roads are, at least in Accra, I've gone out of Accra a number of times, but I've noticed that some places where I would pass and there were literal craters, they are being leveled in so many places. That's a good thing. But how about those parts as well? I salute you, Mr. Minister, on that, Mr. Agbuja. But moving on from there, what do we do about those areas that are still problematic? I know Rome wasn't built in a day, but we are still asking for more, because that impacts our ambulances as well when they have to pick people, and it can even extend to the fire service as well. But today, let's focus on health. If you take from 2019 to date, that means that all the ambulances, even those that were introduced in 2019, would have passed their lifespan. And so they would have all had difficulties in one way or the other, or in one way or another. That's according to Dr. Simon Akayiri Nayaba, the Ghana National Ambulance Service. This is where we find ourselves. And it's a tricky situation. And you look at the National Ambulance Service, Ministry of Health, timely care saves lives. Underline the timely. Because sometimes, owing to the many challenges they face, it may not be so timely. And you know that in emergency situations, well, time is of the essence. Today, I just decided to take a look at our health situation on the back of recent happenings. This is another area where we need to do quite a bit more. There's a lot to be done. Let's put our hands to the wheel and get it done. My name is Benjamin Akakpo. Thank you for watching.